Good morning, good morning, good morning. It is Nurse Eunice with Florida Training Academy, and in today's video, we're going to be caring for a patient with C-Diff or Clostridium difficile. So I'll give you all a few moments to get your notifications and to join me for today's scenario with practice questions. So if you are unaware, Florida Training Academy does CNA exam prep courses. We also do a lot of skills, a lot of CPR classes, and so our job is to help you become a more knowledgeable caregiver, even as an entry level caregiver, and to make sure that you're providing the greatest care possible and to help you pass your test. And we do it for free on our YouTube channel and also on our Facebook page. So let us begin, everybody, and welcome and good morning. All right, so here's our scenario. Our patient's name is Sarah Thompson. Sarah Thompson is a 65-year-old female who is admitted to the hospital with severe diarrhea, abdominal pain, fever. She was diagnosed with, and that's not spelled correctly, but Clostridium difficile or C-Diff. This infection is associated with recent antibiotic use, and Sarah requires special precautions to manage her symptoms and to prevent the spread of infection. And you are her caregiver today. Right, so here's our initial assessment and care. Number one, what is the first step in assessing Sarah upon admission? And this is from the CNA or the patient care tech perspective. Is it reviewing her medication list, performing a head to toe assessment, taking her vital signs, or reviewing her medical history? And if you haven't subscribed to our channel, go ahead and do so. Make that commitment. It helps us in the algorithm. And also share our channel with your family and your friends or anyone who's interested in passing their CNA or their PCT exams. That is correct, team. If you chose C, you are correct. Whenever the person or patient is admitted, your priority is getting those vital signs because it helps to determine the immediate health status and to guide further care. And so if anything is abnormal, her blood pressure is high, her blood pressure is low, pulse ox or oxygen saturation is abnormal, you would be notifying your nurse immediately. Question two, which of the following symptoms is most concerning for Sarah, given her diagnosis of C. diff? Is it constipation, increased appetite, diarrhea, or weight gain? Yes, Jamie, you're absolutely correct. So if you chose C, diarrhea, you know that that is a primary symptom of C. diff, and it can lead to dehydration and other complications. So imagine we have an elderly patient who's been sick, stomach is in pain, she hasn't been eating, she hasn't been drinking, and now she has severe diarrhea on top of it. She is going to become dehydrated. So you want to be monitoring her stool to make sure that she doesn't have an excessive amount of diarrhea. Number three, what should be done to confirm the diagnosis of C. diff? Remember, as the CNA, you're part of the healthcare team, and you may have to do some tests or perform some other functions outside of just getting vital signs. So do you A, perform a physical examination, B, conduct a stool test for the C. diff toxin, C, take a chest x-ray, or D, monitor her blood glucose levels? Looks like Sheena says B, Jamie says B. Anyone else? We'll be revealing the answer in three, two, and yes, you are absolutely correct. So to conduct a specimen or to collect a specimen, whatever specimen, wherever it's at, whether it's in a diaper or on the bed sheets, if you don't have a special collection device, what you see here, like what you see here on the screen, you would take a tongue depressor to scoop it up and put it in a specimen cup similar to what you would put urine in. So some of them have special collection devices like what I have here on the screen. Otherwise, you just have to improvise with a tongue depressor to scoop it up and then put it in your cup, and then you send it off to the lab. But we can usually start our precautions without confirming the presence of C. diff. So because that lab test can take an hour or so to result, and we don't want to delay the way that we treat the patient. All right, so now that we have a confirmation of C. diff, number 4, which intervention is most important to prevent the spread of C. diff in the hospital? Remember, this is a contagious diarrhea. We have patients who are receiving chemotherapy. We have moms who are pregnant. We don't want this spreading throughout the hospital. Plus, we have you as the caregivers. We don't need you taking it home to your kids. So is it going to be A, the use of hand sanitizer, B, frequent changing of bed linens, C, the use of respiratory mask, or D, the use of contact precautions? You all were fast with this response. Great job. So Jamie, Sola, Sheena, you're absolutely correct. We're going to use contact precautions. So C. diff is spread through contact with contaminated surfaces. So contact precautions are essential. So we're going to make sure that we have clean hands, that we wear our gloves, and that we also wear our gowns whenever we're providing care pretty much upon entry into the room. Question number 5, when assisting Sarah with hygiene, what is the most important practice to prevent the spread of infection? A, used alcohol-based hand sanitizer frequently, foam in, foam out. B, washing hands with soap and water. C, wearing a surgical mask. Or D, applying lotion to her skin. Which is the best way to prevent the spread of the C. diff infection? I'm seeing some great answers. I am so proud of you. Yes. So Zypher, Sheena, Shola, Jamie, Tana, yes. You all knew that you can't use hand sanitizer when someone has C. diff. You have to do B. You have to wash your hands with soap and water. And here's the rationale. Hand washing with soap and water is the most effective way to remove the C. diff spore. So that spore is hard to kill. So the alcohol cannot penetrate the spores, which is why we can't use alcohol-based hand sanitizers. Instead, you just want to wash all those germs off of your hands. So hand sanitizer is usually not allowed when a patient has C. diff. We have to do regular old scrubbing for 20 seconds with soap and water. Question number 6, what personal protective equipment or PPE should be worn when caring for Sarah? Is it gloves only, gloves and a gown, glove gowns and a mask, or no PPE is necessary? And I know you're smarter than this. I know you don't want to take any C. diff home to your kids. So what are you going to put on? Yes, Rose. Yes, Tana. Yes, Sheena. Yes, Jamie. You all are absolutely correct. We're going to wear a gown and gloves. All right. So this is the only picture I had from my facility. And yes, they have masks on. So I put a note there that says masks are not needed. But when you're providing care, you pretty much want to look like this. You have your contact isolation gown. You have those gloves. You wouldn't need a mask. That would be overdoing it. But when you're performing care at the bedside, also try to make sure that your body is not touching that bed. Because if your legs, if your pants touch the bed, if your jacket touches the bed, that means whenever you go into another room, your clothing will be transferring the germ to another patient. So that is why we ask that you wear a gown whenever you're caring for somebody with a C. diff infection. Number 7, how should Sarah's room be cleaned to prevent the spread of C. diff? Now, this isn't something that the CNA or the tech would normally do. This is something that environmental services or the oh my god, I can't even think of the name of them now, or the cleaning crew would do. Hospitality. You all will correct me. All right, so is it A, using regular cleaning products, B, using soap and water, C, alcohol-based wipes, or D, using bleach-based disinfectants? So whenever they're disinfecting the room after someone has C. diff, what does the environmental service team clean the room with? And you are absolutely correct if you chose D. This is why we can't do this. You all, we have so many wipes. Could you imagine us picking up a wipe that's so supposed to be used for one thing and maybe using it on the patient? So that's why all the bleach-based products are for environmental services. But using a bleach-based disinfectant is what's going to be used on those bed rails, on the IV pumps, on any surface that that patient may have touched or that a caregiver may have touched. Don't forget to clean the sinks, the faucets, the light switches, and the doorknobs too. Otherwise, whenever the next person comes in, we greet them, we turn the light on, and then we touch them, we give them C. diff as well. Monitoring and reporting. Number 8, why is it important to monitor Sarah's fluid intake and output closely? A, to ensure that she is not overhydrated. B, to prevent constipation. C, to assess for signs of dehydration. D, to document her daily routine. And this is an easy one. Let us see, let us see, let us see. And that was your hint. Let us see. Yes, Jamie. And this is the wrong slide. You know, Miss Nurse Eunice be doing a lot in the mornings. So that's a duplicate of slide that we just had, but the correct response is going to be, let's see what happened there. I do apologize. There we go. C, to assess for signs of dehydration. So diarrhea can lead to significant fluid loss. So monitoring intake and output is crucial. And when you look at this patient's hands, I noticed you noticed that they are quite wrinkled. So the drying of the skin, excess wrinkles, we can also call it tinting when we pinch the skin and it kind of holds its form for a few seconds. It doesn't instantly just fall back into place. That would be a sign of dehydration. And as a good caregiver, you're going to be encouraging fluids. But when someone's stomach is not feeling well, you encourage fluids up to their tolerance. So you don't want to try to force fluids. If you have a good nursing team, the nurses will start intravenous fluids or an IV, because right now, if this person drinks something, it may make their stomach hurt more. Number 9, which of the following signs should be reported immediately as a potential complication of C. diff infection? Is it A, increased urination, B, mild headache, C, severe abdominal pain, or D, elevated glucose levels? Which one are you going to tell the nurse about right away? I see an A, I see a C, I see a B. Revealing the answer in 3, 2, and 1. It is C, everybody. So I know it sounds crazy, right? Your patient came in with abdominal pain. My nurse should be aware. Why would I tell my nurse if the patient keeps having abdominal pain? Because your patient could end up getting toxic. So severe abdominal pain could indicate a serious complication such as toxic megacolon. And that is when the colon, from it being so irritated, it swells up with infection. And so here's another slide that talks about toxic megacolon. So toxic megacolon is an acute life-threatening, yes, we're decreasing the blood flow to the organs, life-threatening complication of inflammatory bowel disease. And you all know my mom's been sick, so my wording isn't correct this morning, so just bear with me. That causes a person's colon to become dangerously distended and inflamed. So you being a great caregiver and notifying the nurse of the continued pain or the worsening of pain can help prevent this patient from becoming toxic and or septic. Number 10, what action should you take if Sarah's diarrhea becomes watery and more frequent? A, increase her fluid intake. B, stop all food intake. C, report it to the nurse immediately. D, give her over-the-counter antidiarrheal medication. So it's like, okay, this person has C. diff. We expect them to have diarrhea. But what if it doesn't stop? What should you do? And you all are so smart. You are great caregivers. Yes, it is C. You have to report it to the nurse. I mean, I know the nurse is probably tired of you at this point, but Miss Sarah isn't because Miss Sarah's going to get better. Worsening diarrhea can indicate a need for further medical evaluation and treatment. Remember, I told you that if the person can't drink it, the nurse would be starting an IV and giving her something intravenously so that she doesn't become dehydrated. And they also have intravenous medications that can help with the stomach. All right, so question number 11, you're doing such a great job caring for Miss Sarah. Why is it important to observe the frequency and consistency of her stool? So remember, when someone poops, you just don't get to flush it down the toilet. You have to document what it looks like, what it smells like. So are you doing that, A, to ensure that she is eating enough, B, to evaluate her comfort level, C, to document her nutritional status, or D, to monitor the effectiveness of the treatment? So Miss Sarah went from calling to use the bathroom every hour to now she's only using it every 4 hours, and the bowel movements are less liquidy. All right, so they are becoming a little formed now. So that means that she would be improving, and that would be the goal while she's in your care. So if you chose D, yes, the treatments that we're giving her is working because you're not having to work as hard and be in that room every hour. So it is to monitor the effectiveness of the treatment. And remember, when you're monitoring that stool, we need to know the color, the consistency, the smell, and how many bowel movements she's having. And if it's liquid, it has to be measured. You just don't dump it. 12. How often should Sarah's vital signs be monitored while she is being treated for C. diff? Is it once daily, every shift, every 4 hours, or every 2 hours? We'll reveal the answer in three, two, and I know this one was a little tricky. So she's sick, but she's not sick, sick. So we don't have to do it every 2 hours. If she was having cardiovascular issues, chest pain or something, that's when we'll do it more frequently. But she's going to be monitored every 4 hours. So regular monitoring of vital signs help to detect any changes that may indicate complications. And so if Miss Sarah's blood pressure was 120/80, there'd be nothing for you to report. That is a normal blood pressure. But with dehydration and fluid loss, she could become hypovolemic. She could have low fluid volume within her body. And so, if the blood pressure went from 120/80 to, let's say, 90/60, that's the indication. You need to let your nurse know. Keep that patient in the bed. Don't get her up. Don't stand her up. Give her a bedpan. Because if her blood pressure is low and you stand her up, she's going to be on the floor and you're going to have to take care of this patient even long term. So we don't want that happening. Question number 13. You did such a great job. I'm so proud of you. We're ready to get her out of here. She's going to be discharged. 13. Why is it important to educate Sarah and her family about C. diff precautions? Is it A, to ensure they understand hospital policies, B, to reduce hospital readmission rates, C, to involve them in her care, or D, to increase their knowledge of C. diff? I see a B, I see a D, I see another B. All right, so I want to tell you about this because with my mom's recent hospitalization, um, I was not happy with the staff because a lot of them would talk around her. They would talk about policies and procedures, and they were forgetting that they were taking care of a patient. So, yeah, we don't want to increase hospital admission rates. And yeah, we want the family to know more about C. diff, but the priority in all of this is the patient. So, the correct response is C. Remember, it's about her and her care. So we need to involve them in her care. So education empowers the family and the patient to take an active role in preventing the spread of infection. So now look at her husband and look at her grandbaby. If we don't involve the family in her care, if they're not washing their hands, if they're not monitored for dehydration, as soon as she gets home, she's going to kiss that beautiful baby. And now, guess who gets the C. diff next? Her elderly husband, and the grandbaby. So we have to include the whole family in the care because we provide holistic care. We just don't follow hospital policies. Question number 14. What advice should you give Sarah's family to help prevent the spread of C. diff at home? And everyone should get this right. Is it A, use alcohol-based hand sanitizer frequently? B, wash hands with soap and water after using the bathroom? C, avoid visiting during her illness? Or D, wear a mask when in her presence? I expect 100% of you all to give me the correct answer. I know you can't see me today, but I'm doing my nursing dance, and you all know Miss Eunice's goofy nursing dance. So if you all chose B, you chose the correct response. She doesn't have to be isolated. They just need to wash their hands, especially upon entering. And then every time anyone uses the bathroom, make sure that hand washing is performed because it's crucial in preventing the spread of C. diff. Number 15, what should Sarah do if she experiences severe diarrhea at home? Is it drink more fluids, take over the counter medication, contact her healthcare provider immediately, or increase her fiber intake? And Ajit Kumar, you're welcome. All right, revealing the answer in 3, 2, and for all of my C's, you got it right. She has to call her doctor. Don't be taking any Imodium or anything. We're not trying to mask this. We need to get it all out because severe diarrhea requires prompt medical evaluation and treatment. Remember, she's elderly. She can become dehydrated. So it's just not an issue of her pooping. It's the issue of her having other medical complications because of the number of times that she's having bowel movements. Question 16, why should Sarah's family be cautious about cleaning surfaces in the home? Is it A, to prevent stain in the furniture, B, to ensure the home stays tidy, C, to avoid damaging household items, or D, to prevent the spread of infection? Because we know that Miss Sarah is going to be mad if you use a bleach wipe on her wood surfaces. But it's not about her wooden surfaces right now. It's about making sure that she is safe and that she gets well. So what is the correct response? 100% of you all gave me the correct answers. Very good. D, to prevent the spread of infection. Number 17, how can Sarah's family help with her hygiene to prevent the spread of C. diff? A, by assisting with regular hand washing. B, by using hand sanitizer. C, by limiting her contact with others. Or D, by avoiding all physical contact. And sometimes I think that we forget, especially if a patient is bedbound, we forget that they also need to wash their hands too. So if a patient has C. diff and they're bedbound or they can't get up because they're really weak right now, I need for you all to be bringing a washcloth with a soapy washcloth with soap, and then another one that has water on it. Because as a reminder, they can't use C. diff. They can't use the hand sanitizer because the hand sanitizer cannot penetrate the pores in order to kill C. diff. Question 18, and we're almost to the end, team. It's been a long shift, but you've been taking great care of Mrs. Sarah. Question number 18, what type of diet should Sarah follow during her recovery from her C. diff infection? Is it high fiber, a low fiber, high protein, or low carb diet? What type of diet should she follow during her recovery? This one's tricky. I see A's, I see C's. So this one is tricky because we need her to have a low fiber diet. You all know that fiber helps people have bowel movements, right? And she just had a whole bunch of bowel movements. So what she doesn't need right now is high fiber. And we know that protein inconstant though. The best thing for her to do right now until she's better is to avoid things that are high in fiber, such as grains and bananas and breads that are not overly processed. So she can have other items, just not fiber in the immediate days after her C. diff infection. Next question, number 19. What is an important sign of dehydration that Sarah's family should watch for? Is it increased urination, increased energy levels, excessive sweating, or dry mouth and skin? Do, 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 do. Kamala, Duna, Janie, Christine, you all are absolutely correct. Yes. So let me give you another one of Eunice's pet peeves. I'm in the hospital. My mama's lips are looking like this. Even if she can't have anything to eat or drink, you take a swab, you dip the swab in some cold water, and you go around her mouth, her lips, her tongue with the swab. Do not allow your patient's lips to look like this, even if they are NPO, even if they have an order where they can't eat or drink. As a CNA, as a future nurse, you still provide mouth care. So when the lips look like this is a common sign of dehydration, which can occur after having bouts of diarrhea related to C. diff. So you still provide mouth care. You can put ointment on her lips, but then, of course, that nurse should be starting some IV fluid to prevent the dehydration. Question number 20. Why should Sarah avoid taking over-the-counter antidiarrheal medications without consulting her healthcare provider? Is it because they cause constipation? They may interact with her other medications. They may worsen the C. diff infection, or they could lead to weight gain. So why can't she just go and take some over-the-counter Imodium? Revealing the answer in 3, 2, and Diulin and Sheena, you all are correct. And then Jamie, it's not that you're wrong. It's just that this one was specifically asking about the over-the-counter antidiarrheal medications. And remember, we want this infection to work its way through. So we don't need her stopping her bowel movements. So it is C, the over-the-counter antidiarrheal agents can worsen her C. diff because it's not allowing the bug to pass through her system. So we don't give them anything like this. And then you all, so proud of you. All right, so I'm old school. We just don't call people who are older than you by your first name. I'm from the South, so I have to put Mrs. in front of Sarah. So Mrs. Sarah says thank you. And let me tell you all the care you provided on your shift today. You provided great care. You completed the admission vital signs. You monitored Miss Sarah's pain level. You collected the stool sample. You used the appropriate PPE. You monitored her intake and output. You educated her and her family, and you reminded everyone to wash their hands to prevent the spread of the C. diff infection. And then you washed your hands and you took your clothes off as you entered your house because you don't want to be walking through your house with that C. diff uniform on and those nasty shoes. And then you threw those in the wash and you took your bath and then you had your dinner. And guess what, everybody? Great job. So I need you to give yourself applause. And so at some point, I'm going to start adding these slides to my website, which is fltraining.com. But again, this is Nurse Eunice with Florida Training Academy. For all of you all who've been praying for my mom, I thank you so much. I'm about to get off of this live right now and go see about my baby. So love you all. Take care. And I'll see you in the next video. Bye-bye.